Hello, welcome. I'm Janu Goel. In this section, I will review some important anatomical concepts for ankle and foot sonography. The 28 bones which form the skeleton of ankle and foot include the lower end of tibia and fibula, 7 tarsal bones, 5 metatarsal bones, and 14 phalanges. The three main joints of ankle and foot are the distal tibio-fibular joint between the lower end of tibia and fibula, which is a syndesmotic fibrous joint between the lower ends of tibia and fibula. A 4 mm synovial extension from the ankle joint extends into this joint, and the ankle joint between the lower end of tibia, fibula, and the talus, or the talocrural joint, and the third is the subtalar or the talocalcaneal joint. And apart from these three main joints, there are joints between the tarsal bones called intertarsal joints, joints between the tarsal and metatarsal bones, which is tarso-metatarsal joints, joints between the metatarsal, the intermetatarsal joints, and the joints between the metatarsals and phalanges, the metatarsophalangeal joints, and the joints between the phalanges, they called interphalangeal joints. So there are tons of joints in the ankle and foot for the sonographic evaluation. Let's look at the anatomical concept of sinus tarsi. The sulcus calcanei is a deep groove which separates posterior and middle talar facet of calcaneus and gives attachment to introitious talocalcaneus ligament. And the sulcus tali is a deep groove between the posterior and middle calcaneal facet of talus. When both talus and calcaneus articulate with each other, the sulcus tali together with sulcus calcanei create a tunnel between the posterior and middle articular facets of calcaneus and talus, known as sinus tarsi. In-depth knowledge of foot and ankle anatomy and different joints is important while scanning and performing interventions on foot and ankle. Not counting metatarsophalangeal and interphalangeal joints, there are 6 separate joint cavities in the foot between the tarsal and metatarsal bones, which include subtalar joint, talocalcaneo-navicular joint, calcaneo-cuboid joint, cuneo-navicular joint, medial cuneo-metatarsal joint, and cuboideo-metatarsal joint. There are 2 separate articulations between the talus and calcaneus. The posterior articulation forms the subtalar joint proper between the posterior facet of calcaneus and the posterior part of inferior surface of talar. The anterior articulation, the talocalcaneo-navicular joint, forms a single joint cavity between the head of talus, the navicular superior surface of spring ligament, and between the anterior and middle facets of calcaneus and talus. The calcaneo-cuboid joint is 2 cm proximal to the tuberosity of 5th metatarsal bone and lies almost in the same transverse plane as the talonavicular joint. Both these joints, talonavicular and the calcaneo-cuboid, have a separate joint cavities, but together are known as mid-tarsal joint or transverse tarsal joint or Chopard's joint. The cuneo-navicular joint is an articulation between multiple bones. The articulation between the navicular, the cuneiform bones, the articulation between the cuneiform and the articulation between the lateral cuneiform and cuboid, navicular and cuboid, and the tarso-metatarsal articulation in second and third tarso-metatarsal joint, and the intermetatarsal articulation between second, third, and fourth metatarsal form a one continuous joint cavity called the cuneo-navicular joint. The fifth articulation is the articulation between the medial cuneiform and the first metatarsal bone. And the sixth articulation includes the cuboid and the articulation between fourth and fifth metatarsal and the intermetatarsal joint between the fourth and fifth metatarsal bones form a continuous single joint cavity. Let's look at the lateral aspect of the foot. The lateral aspect of the lateral malleolus is subcutaneous and is palpable. The fifth metatarsal bone has a tuberosity or the styloid process on the lateral side of its base. The tuberosity can be seen and felt midway between the lateral border of the foot. The peroneal trochlea is a palpable landmark about 2 centimeters distal to the lateral malleolus. An elevation for the attachment of the calcaneofibular ligament may be felt about 1 centimeter above and behind the peroneal trochlea. The calcaneocuboid joint is the joint between the calcaneus and the cuboid and lies about 2 centimeter proximal to the tuberosity of the fifth metatarsal bone. This joint lies almost in the same transverse plane as the talonavicular joint. The talonavicular joint and the calcaneocuboid joint have separate joint cavities but together are known as transverse tarsal or mid-tarsal joint or the Chopard's joint. The ligaments which can be examined from the lateral aspect of the ankle include anterior and posterior tibiofibular ligaments and all three components of the lateral ligaments. The anterior and posterior tibiofibular ligament pass upwards and medially from the lateral malleolus to the distal end of tibia, anterior and posterior to the distal tibiofibular joints. The lateral ligament has three components: the anterior talofibular ligament, the calcaneofibular ligament, and the posterior talofibular ligament. The anterior talofibular ligament passes between the anterior margin of the lateral malleolus and the anterior aspect of the body of the talus, and the calcaneofibular ligament passes downwards and backwards from the tip of the lateral malleolus to the lateral aspect of the calcaneus, and the posterior talofibular ligament passes from the malleolar fossa on the lateral malleolus to the lateral aspect of the lateral tubercle of talus. The fibularis longus takes origin from head and the proximal 2/3 of the lateral surface of fibula. The tendon runs distally behind the lateral malleolus and lies in a groove shared with fibularis brevis. The fibularis longus is superficial to fibularis brevis and lies behind fibularis brevis in the groove. The tendon crosses the lateral side of the cuboid and runs in a groove under the cuboid to its insertion to the base of first metatarsal and the medial cuneiform. A fibrocartilage sesamoid known as os peroneus is usually present where the tendon makes a turn on the cuboid. The fibularis brevis arises from the distal two-thirds of the lateral surface of fibula anterior to fibularis longus, and the tendon passes through the groove together with the tendon of fibularis longus behind the lateral malleolus and inserts on the tuberosity of the fifth metatarsal bone on the base of the fifth metatarsal bone. The medial malleolus is a palpable projection from the lower end of tibia. The sustentaculum tali of the calcanea can be felt 2 cm below the medial malleolus. The tuberosity of navicular is usually visible and can be felt about 2.5 cm anterior to the sustentaculum tali right here. The deltoid ligament is a strong triangular ligament which is attached to the anterior and posterior borders and apex of the medial malleolus. The anterior superficial tibio-navicular fibers of deltoid ligament are attached to the tuberosity of the navicular, and the deep tibio-talar fibers are attached to the medial surface of the talus. The tibiocalcaneal fibers descend almost vertically from the medial malleolus to the sustentaculum tali. The posterior tibio-talar fibers pass from the medial malleolus to the medial side of the talus to its medial tubercle. The plantar calcaneonavicular or spring ligament is attached to the interior margin of sustentaculum tali and the plantar surface of a navicular. The ligament has a fibrocartilaginous facet on its upper surface for articulation with the head of talus. The structures seen on the medial side of the ankle from anterior to posterior are the posterior tibial tendon, the flexor digitorum longus tendon, posterior tibial vessels, tibial nerve, and the flexor hallucis longus. The posterior tibial tendon lies in a groove behind the medial malleolus and it inserts on the tuberosity of navicular with fibrous extension to all tarsal bones except talus and to the bases of lateral 4 metatarsal bones. The flexor digitorum longus tendon passes behind the medial malleolus posterior to tibialis posterior tendon. It crosses superficial to flexor hallucis longus tendon to enter the sole of foot deep to abductor hallucis. The flexor hallucis longus tendon lies in a groove on the posterior aspect of talus behind the ankle joint anterior to the Achilles tendon. It passes forwards in a groove below the sustentaculum tali, passes deep to flexor digitorum tendon and passes between two sesamoid bones on the head of first metatarsal bone and inserts on the base of distal phalanx of great toe right here. The flexor digitorum and flexor hallucis tendon cross each other under the midfoot at a point called the knot of Henry. The medial to lateral, the tendons on the anterior aspect of the ankle are tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius, all held in place by the superior and inferior extensor retinacula. The anterior tibial artery and deep peroneal nerve pass deep to the superior extensor retinaculum and are located between the extensor hallucis longus and the extensor digitorum tendon. At the ankle, the deep peroneal nerve is lateral to the anterior tibial artery. The tibio-talar joint is located deep the tendons and ligaments. Posteriorly, the two heads of gastrocnemius and the soleus muscle converge to form the Achilles tendon, which inserts on the midpoint of the posterior surface of calcaneus. Deep to the Achilles tendon is a Kager's fat pad that separates it from the flexor hallucis longus muscle. The retrocalcaneal bursa separates Achilles tendon from the posterior superior aspect of calcaneus. Medial to lateral, the tendons of tibialis anterior, the extensor hallucis longus, extensor digitorum longus, and the peroneus tertius pass from the ankle to the dorsal aspect of the foot. Tibial artery becomes a dorsalis pedis artery. Extensor digitorum brevis muscle and tendon are located deep to the long tendons. Joints of the foot, which are seen with the sonographic examination, include the joints between the tarsal bones, the tarso-metatarsal joints, intermetatarsal joints, the joints between metatarsals and phalanges, that is metatarsophalangeal joints, and the interphalangeal joints. The joint between the talus and navicular and the joint between calcaneus and cuboid lie on the same plane, have separate joint cavities but have a common name called mid-tarsal or transverse tarsal joint or the Chopard's joint. The joints between the metatarsals and the tarsal bones are jointly known as Lisfranc's joint. Let's further look into the MTP joint anatomy. The articular surface covers the distal and the plantar aspect of the metatarsal head but does not cover the dorsal aspect. The first metatarsal head has two sesamoid bones embedded in the joint capsule. The fibrous capsule is attached to the articular margins. The thick, dense plantar ligament are attached firmly to the base of the phalanx and loosely to the metatarsal bones. The plantar aponeurosis is an extremely thick layer of the fascia attached posteriorly to the medial process of calcaneus. Anteriorly, it splits into 5 slips. Each slip is firmly bound to the proximal phalanx of the toe by the plantar ligament and the fibrous flexor sheath.